Hello, everyone. How's everyone doing? I'm doing great today. Had a very busy day. It took me a little bit of time to get to this video, but it's an important one. So I really am focused on getting it done. And I think it's a good one. Um, I think the public needs to know, what do we do? What the heck do we do? Information about nursing goes out to students or prospective students for college or university who want to become licensed practical nurses, registered practical nurses, even personal support workers, and registered nurses. I'm saying personal support workers because they're also work in the healthcare system. They're not registered in Ontario. They're not licensed. There are other terminologies like healthcare aides. Around the world, they may be using different terminologies. But when I'm speaking of nursing, I specifically speak about registered practical nurses, licensed practical nurses, and different levels of registered nurses. And I'm lumping it together because I'm not just speaking of Canada or Ontario or all the provinces, but I'm also speaking of North America and the Western world, or in certain countries where it's similar to what it is in Canada. The other parts of the world, it's a little bit different. And so I just wanted to clarify geographically what I'm speaking about. But nursing exists in all countries, but nursing, not just nursing, but taking care of people that are recovering or are sick or have been sick. And so modern day nursing really started in the 1800s with Florence Nightingale. And many people have heard her name, and you can certainly Google her up. And she was a really interesting lady, very well educated, very smart. She was an epidemiologist, actually, and very good with math. So that really helped her. But before we get to Florence, I want to just kind of talk about, in general, healthcare and very, like, 1 minute history. If we go back in time in history, a lot of people that were taken care of, usually in whether tribal societies and or even in the Middle Ages, a lot of times, sort of in the country or in indigenous areas, it was either shaman, a medicine man, medicine woman, midwives, or someone that was well versed in herbal medicine or herbals or what was growing around, either wild or was cultivated. So there were people who just knew how to do things. And I can say this because my grandmother was one of those people. She just knew what to do when there was no medicine, and there was a lot of, same with my great grandmother. So that's something that kind of got passed down because there was nothing else. Now, being a doctor or a physician, it goes even back to Greek times, and they were more theoretical, and they were talked about, different humors and looking at what would help, and we all heard of the Hippocratic Oath or Hippocrates. But a lot of people that over the ages that afforded doctors, especially before modern day medicine, were usually the wealthy. So royalty and those who had money and who had more influence, versus the populace was usually taken care of by women who usually were midwives. And so sometimes they were not looked upon very nicely because there were these doctors who were looking at anatomy, physiology, and certainly we have beautiful art from that era. However, who was taking care of them was usually women who were also delivering babies, and they may have known some herbs and also maybe some medicine men. They may have used some drumming, herbal medicine, hands-on healing, singing, many different versions of healing modalities. And I'm mentioning this because we're going to come back to this in a roundabout way in another video. So that was sort of the basics. But during the 1800s, a few things came up that sort of brought up modern medicine. So one of them was actually Ignaz Semmelweis, who discovered that when he washed his hands between looking at anatomy, physiology in with the cadavers, and then also delivering babies and looking after women after delivery, that when he washed his hands between women and all these activities, that they tended not to pass away from fever or get an infection. And so they actually laughed at him. And I don't think even in his lifetime that he actually saw this to be as a practice. But at the same time, the whole germ theory was gaining some traction. So hand washing actually was a huge movement forward for us. And even to this day, one of the main reasons that infection control is what infection control does is actually is hand washing. And we even record it and measure it in the healthcare system. At least in Canada, we do. And hospitals even compete and do a whole bunch of stuff just to get that hand washing number up. So it's an important one. But the other thing that happened was the Crimean War, and Florence Nightingale went there with some nurses, and she even trained somewhere to help the wounded. And one of the things that she did was she used statistics and mathematics and numbers to actually prove her point that if they actually created hospitals that were better built, and there was space and the environment was clean, that it actually increased more, that people were surviving, or soldiers were surviving. So that actually was really amazing. But she also came from a good family, had good education. So she was able to speak that language and convince people. When I looked at nursing of history, there's a few of them, and I'm going to leave them in the link. There was also a woman from Jamaica who was also a nurse and used her own herbal medicines from her own money to help in the Crimean War, help soldiers. So I just thought I'll mention that because we don't hear about that too much. And so that should be noted. So I'm going to leave a link about the 25 most interesting nurses in history. The other person that I really wanted to mention very briefly is Virginia Henderson. And this was further along in the 20th century. And she was one of the first ones that actually came up with the nursing theory. And most people probably are not aware that there's such a thing as a nursing theory. And so she came around to actually define nursing. So when we look at Florence Nightingale, she basically defined nursing as, and I quote, puts the patient in the best condition for nature to act upon. Him or her. So basically the environment, utilizing the environment that the patient can recover and heal. And Virginia Henderson, within those same vein, she defined it as a unique function of a nurse to assist the individual, sick or well, in the performance of those activities, contributing to health or its recovery, or it is a recovery. So this is really important. Because nursing doesn't just deal with sick people, it deals with health, meaning the best that you can be. And so that makes nursing a much bigger area of expertise versus just we deal with the sick people. We also deal with health promotion and also prevention of diseases. And this is really important. And this was already recognized by Virginia Henderson. We have a lot of other theorists, and that can be a whole other, that can be like a whole lecture, and we can, do a course on this. But the important thing is that we do have theories where we look at the person. We look at the person holistically, so physical, intellectual, emotional, mental, financial, social, religious, ethnic, cultural, all those aspects, because all of those aspects influence how a person is doing with their well-being, how they perceive the world around them, what they eat. Is that good or bad? Is it good for the health? Is it healthy? And then this is where genetics comes in as well. So we know culturally where people stand, we can predict, and we can also help them prevent some of those troubles. But the more important, I think, from this perspective, what I wanted to bring to this today, and I really don't want to go on too much, nursing does a lot of tasks, but all those tasks, and this is what I'm trying to really bring to understand, is that they're very, very detailed. And we, if you would look up a particular procedure, some of the steps that we take can go up into the 30-something odd steps. Like, let's say if you're doing a really complex dressing. And we had to memorize all of that initially. When I used to get my basic nursing skill book, and it was a little binder, I thought, oh my God, how am I going to remember all this? Now, once you do it over and over and over, but there's just so many steps that it can be quite daunting. So remember, those nurses who are really experienced, that those who are not so experienced, it takes a while to master it, because you just learn it. And then those of us or the patients and patients' families, to remember that there are variations and there's certain steps, but there's variations within the steps, but also to respect that the amount of information that they have to learn actually to be able to perform what they're doing. It's a lot of work, and it takes a lot of testing. So we do a lot of testing. Someone actually did a test on what is the most difficult university course. And it turns out to be nursing. And that kind of shocked me. I was like, why the heck? And then when they actually were explaining how many times we have to be tested, it makes sense, because we test you write a test like anybody else in any course, but then every skill that we allow a student to do, we test them before they're allowed to do it. And then when they're doing it, they're being tested. So actually you're being tested all the time. So now it kind of makes sense why we're always nervous in clinical, because we're constantly being tested. And then when you graduate, the senior nurses are testing the junior nurses, and this is an ongoing thing. But it's kind of built in that idea of ongoing learning, and that's a really good thing. So most nurses are constantly learning throughout their career, because there's always a change or a better way of doing things, better way of assessing things. The cornerstone of nursing is obviously nursing theories on how do we view a human being and our patients, because everything is around the patient. But around the patient, there's many systems. So society, family, religion, culture, and so on, like I mentioned before. But the other thing that we look at is we have a process, and we call it the nursing process. But the nursing process is not any different from what an engineer does, or let's say a computer analyst does. We analyze, we look at a problem, we assess it, we define it, we do something about it, and then we check it. Did we get what we wanted? If we didn't, we go back to the beginning. We just call it the nursing process. It's nothing magical, but we do it. So when a nurse comes to assess you, they're actually doing real work when they're asking you certain questions like, what is your diet? Are you a vegetarian, a vegan, kosher, whatever it is that you want to eat? Because it does matter. And we want to make sure that we can provide you with that. So, and interestingly enough, medicine kind of grew up with nursing, but medicine became very different. Initially, medicine was, I think, much more holistic than it is today. That's my personal opinion. So please, you can certainly voice your opinion if you like. But one of the things that happened with medicine is that it was encompassing a lot of the different things, and a lot of things still were used as tinctures and more plant medicine. But with the advent of pharmaceuticals, that kind of changed over. Same with certain procedures and certain things. And as science grew, it became a little bit more detached, I think, from what it was. However, with the advent of a lot of technologies, both nursing and medicine grew to the point where certain other healthcare professions sort of veered off of it. So meaning we actually were it as nurses and doctors. And then all of a sudden we ended up with physiotherapists and respiratory therapists and other professionals, speech language pathologists. And some of this became apparent or needed because the patients changed. They lived longer, they had more unique situations. So we needed specialties. And I actually will take you all into those specialties and what they do, because I know a lot of people don't know who they are. So this focus was pretty much on nursing. But before I go, basically, I want to just quickly say that nursing not only does all these things, but we have many branches of nursing, and there's different types of nursing. And that's what makes it so beautiful. So if there's right now a student listening, one good thing about nursing is you can do so many different things, you'll never be bored. And that's why I've been doing 31 years and I've always done something different, which allowed me to be more versatile. It allowed me to study about different things, because you can do business, you can do a nurse practitioner, you can go all the way up to your PhD and create new knowledge and do research. You can also work with computers and educating and actually building systems and analyzing how nurses use computers and knowledge. There's so many different ways. Privacy, some people deal just with health data. All of that can be part of nursing and nursing analytics. I mean, computer analytics just within the nursing profession itself. But then within nursing, there's cardiology, there's intensive care, there's emergency, there's pediatrics. And within pediatrics, there's all the different specialties. And then there is medicine. Medicine is massive with respirology, cardiology, immunology. And then within surgery, there's GI, there's a genitourinary, and then of course there's labor and delivery and maternity. So there's a lot of areas that you can go to. So it's kind of exciting. And actually, you study a little bit about everything when you're in school, but once you go out to graduate and you go into a certain area, I highly recommend you go into a general area and then go into the specifics. That way you get your feet wet. Nurses work very hard. One of the things that's really, really important that I want to emphasize, nurses are skilled. They have to be. They're skilled experts at reading human behavior and human function, like the bodily, actually how we function, in order for them to help you to be the best that you can be. And while they're doing this, they have a lot of patience. And also they have a lot of patience, as in they have to be able to do this in a calm and organized manner. Is it always perfect? Absolutely not. Is it tough sometimes? Absolutely. But we also are trained how to handle emergencies, how to save someone's life, how to do CPR, how to do first aid right away, and then how to get help. And certainly once you get into more emergency and or intensive care, now you're dealing with much more sicker people, and you have even more technology. So you have to be comfortable with those technologies, more physicians, more medications, more things to do, and more things to figure out and critically think in what's going on. However, it also has its rewards. The camaraderie, as well as there are some nice warm fuzzies where you know that someone survived or you really had made a difference. And you go home feeling good about yourself that you accomplished something. Does it happen all the time? No, not necessarily. It's like with any job. Do I love nursing? Absolutely. I think nursing is a wonderful field because you are a giving, kind, compassionate being that really helps people. And sometimes a lot of nurses don't realize the difference that they make every day because people don't tell us always. They don't always come and pat us on the back and say, hey, thank you. And sometimes they do, or they bring us a little gift, or they bring us coffee or something like that for the ward. And we're just like, wow, that's amazing. And we appreciate that. So if you ever have been sick and you had family members, please thank your nurse. They will really, really appreciate it. And those who want to go into nursing, yes, absolutely. It's not an easy job. And even the courses are not easy, but it is rewarding. And you have a lifelong learning ahead of you that is actually amazing. So I hope I helped you guys understand nursing a little bit better. There's a little bit of video, so watch that. I hope you enjoy it. And the next thing I'm going to talk about is actually is about the next video will be about patients and how do they know who to see when they're having some challenges and what all the different specialties are, not in nursing, but overall. So until next time, I'm signing off and I'm having fun with these videos. And so please do tell me what you like. Tell me what you want to know more about in the comments. And I will leave some links down below that will actually give you more information on some amazing nurses that I have found fascinating. And like I said, if you want anything else, let me know. And for now, I'm signing off. Have a wonderful weekend, and I will be up here soon giving some patient education. Take care. Bye-bye.